Okay, so welcome back, guys, to the last quiz on physiology. And today we'll have questions on all the units and concepts of physiology. Okay, so let's start. Here's your first question. 25-year-old male is subjected to high altitude environment. After a few days, his hemoglobin concentration and RBC are found to be elevated. So, which of the following is the most likely cause of this physiological response? Okay. Yeah, the right answer is hypoxia-induced erythropoietin secretion. Okay, yeah, the right answer is hypoxia. Let's see the second question. A man presents with exertional chest pain. ECG reveals ST segment elevation in leads V1 to V4. Cardiac troponins are elevated. He is diagnosed with acute MI involving the anterior wall. So, which of the following best explains the prolonged contraction time of ventricular muscle during this event? Yeah, it is due to calcium influx during the plateau phase. Okay, so let's move on to the next question. Okay, a 50-year-old man with COPD complains of increasing shortness of breath. His arterial blood gas analysis reveals hypoxemia and hypercapnia. So, which of the following best explains the stimulus driving the respiration in this patient? So, in chronic CO2 retention, another gas becomes the main respiratory driver. So the answer was peripheral chemoreceptor, which is responding to the low CO2. Okay. Okay. All right. Let's see the fourth one. 28-year-old woman presents with severe dehydration due to the acute gastroenteritis. Which of the following hormones is primarily responsible for water resorption in the collecting ducts in response to this condition? So an easy question. So this is a substance which is released from the posterior pituitary, okay, that concentrate the urine, right? It is ADH. Okay, here's your fifth question. A 22-year-old man presents with right-sided weakness following a stroke. So neurological examination reveals increased muscle tone and hyperreflexia. So which of the following best explain the hyperreflexia observed in this patient? To give a clue, this happens when the upper control over the reflex is lost, like cutting the brakes. Let's see if you can get the answer. Okay, the correct answer is loss of inhibitory signals on the upper motor neurons. So easy one. Okay, all of you have got it right. Okay, moving on to the sixth question. A 40-year-old man presents with bloating and foul-smelling diarrhea after consuming dairy products. A hydrogen blood test is positive. Which of the following is the most likely deficient in this patient? So, which enzyme is responsible for this? So, this enzyme normally breaks down a sugar in the milk. Right, it is lactase. Okay, let's see the seventh question. A 16-year-old girl presents with primary amenorrhea. She has well-developed breast but scanty pubic hair and axillary hair. On examination, her external genitalia appears normal, but the vagina ends in the blind pouch. Which of the following is the most likely diagnosis? Here, to give a clue, she looks female outside, but her receptors didn't listen to a major male hormone. So let's see if you can get it. Right, it is androgen insensitivity syndrome. Okay. All right. Let's see the eighth one. A 70-year-old man with long-standing hypertension presents with fatigue and mild pedal edema. On examination, S3 is out. ECG reveals an ejection fraction of, echo reveals an ejection fraction of 35%. Which of the following best describes his cardiac condition? This is a classic case of pump failure. The ventricle can't push the blood well. Right, it is systolic heart failure with reduced ejection fraction. Okay, moving on. A 45-year-old man with history of chronic alcohol use presents with confusion and vomiting. Arterial blood gas analysis reveals pH is 7.25, HCO3 is 14, PCO2 is 30, sodium 140, chloride 100, potassium 4. What is the most likely acid-base disorder? The low bicarb and low pH are your clues. So think about unmeasured anions. Yeah, it is high anion gap, metabolic acidosis. Okay, here a 36-year-old woman presents with weight loss, anxiety, and palpitation. Her TSH is low, T3, T4 are elevated. A radioactive iodine uptake scan shows diffuse uptake. Which of the following best explains the TSH suppression in this case? So negative feedback from the thyroid gland is working overtime here. Okay, all of you have given the answer. Let's see. Right, it is primary hypothyroidism causing a negative feedback. Okay, at the end of 10 questions, we have Sai who is leading the quiz, and we have Ace in the second place, Myra in the third place, and we also have Aisha, Dr. Reedstock, Krishna, Shankar S, Pakia, Shalini, PKSM, and Neat UG. All right, let's see the 11th question. A patient with Conn syndrome has persistent hypertension and muscle weakness. What is the primary electrolyte imbalance here? It's all about too much aldosterone and what it throws out. Okay, I've missed one option here. Right, it is decrease in potassium. These questions might be easy, but we are actually revising it, okay? Okay, the 12th question is a 72-year-old man with long-standing hypertension presents with exertional dyspnea. Echo shows concentric LV hypertrophy. What is the most likely cause? Right, it is due to increase in afterload. Okay, a 40-year-old man presents with polyuria, polydipsia, and hypernatremia. Water deprivation test shows no change in urine osmolality. After desmopressin, urine osmolality increases significantly. What is the most likely diagnosis? The kidney can respond here. The issue is higher up in the hormone chain. It is central diabetes insipidus. Okay, here's your 14th question. A 55-year-old man has recurrent duodenal ulcer. Fasting serum gastrin is markedly elevated. Which of the following best explains the acid hypersecretion? So it's a gastrin producing tumor and it's not shy. Right, it is gastricoma. 15th question. 24-year-old medical student suddenly stands up after prolonged sitting and feels dizzy. BP drops, heart rate rise, which reflex is responsible for this compensation. So the right answer is bioreceptor reflex. A 30-year-old woman presents with heat intolerance, weight loss, and anxiety. TSH is low, T3, T4 is high. Which mechanism explains the low TSH? Okay, so there's one option is not here. I think there's a glitch. So this was okay. There's an option missing here. Okay, this won't be counted. Okay, a patient with spinal cord injury has intact reflex but no voluntary movement below the lesion. Which tract is most likely damaged? To give a clue, this tract carries motor commands from brain to spinal cord. The right answer is corticospinal tract. Written question is patient with severe aortic regurgitation has pounding pulse and white pulse pressure. What is the primary cause of white pulse pressure? So here too much blood flows back, causing high systolic and low diastolic flow pressure. Sorry. So what is the primary cause for white pulse pressure? Okay, last second question. Tummy flaccid ulcer. Which of the following is most affected? So this nerve will was helping in stimulating the acid secretion. Okay, okay, all of you have answered. Let's see. Right, it is. It's free secretion. Okay, the last question. A 60-year-old man with interstitial lung disease shows reduced lung compliance. Which of the following is most likely seen in spirometry? Think about volumes, not the airflow, because this is interstitial lung disease. Okay, so what will be the pattern seen in spirometry? Right, it is due to decreased vital capacity. So, Ace is the winner of the quiz. So, congratulations. And we have Sai in the second place, Aisha in the third place. So, congrats to you both as well. We also have Myra S, Shalini Bhagya, Krishna Shankar, Dr. H. Star, PKSM, and Native. So, congratulations. And that's a wrap for physiology quiz today. So, we have completed all the 19 subject quiz, and we'll inform you about the any future quiz sessions or any changes in the plan. Okay, so we'll be sending it in the Juxtamed Telegram channel. So please follow the channel and we'll update you soon.